related to cardiac remodeling. So first question is like, how does cardiac remodeling contributes to the management of both heart failure and hypertension, sir?
Sure. So thanks very much for that question. What we know from clinical trials is that the medicines that have been shown to help patients with heart failure and reduced ejection fraction live longer all have a beneficial effect in either slowing the remodeling process or reversing the remodeling process. And what we think is that the increase in ventricular diameter increases wall stress. That increase in wall stress is a signal to increase neurohormonal activation. And by blocking those neurohormones with drugs, like sacubitril valsartan, we can induce reverse remodeling and help patients live longer. We now are using that concept to mechanically shrink the ventricle, to make the ventricle smaller in order to reduce wall stress and help patients feel better and help patients live longer.
Thank you very much, sir. Can you elaborate on the latest device used in cardiac remodeling for heart failure and how these devices are improving patient outcomes?
Absolutely. There have been a number of attempts to try to remodel the heart mechanically. Some of these are passive constraint devices like the Acorn device, which worked very, very well, but was not approved for use because of concerns about the need for subsequent surgical procedures like bypass surgery not being capable with that device in place. We've also seen the Coapsis device, which, although it's not currently in use, there was a signal that it could reverse remodel the heart. Currently, the device that we're investigating is something called the AccuCinch device, and this is a ventriculoplasty. It is a band that is inserted into the ventricle, and when tightened, it reduces the left ventricular diameter, and it takes some of the strain off of the left ventricular free wall.
Thank you very much. So, like, what are specific patient criteria or parameters makes cardiac remodeling necessary, and are there any specific indicators that shows the patient would benefit from this therapy?
That's a very good question. I think to begin with, we're looking for hearts that are enlarged. So these are typically what we encounter in patients with heart failure with reduced ejection fraction, a more spherical, enlarged left ventricle with a reduction in ejection fraction. We're looking for hearts that still have some plasticity, where there is the potential for reverse remodeling. So we tend to exclude those patients whose hearts are affected with a low ejection fraction, less than 20%. And on the other hand, we don't want hearts that are still relatively healthy. So hearts with an ejection fraction greater than 40 or 45% would typically not be candidates for this type of therapy. So an ejection fraction range between 20 and 40% would be ideal.
Thank you. So, how?
CT scans or with cardiac MRI to understand better how the heart remodels itself in 3 dimensions. It's also giving us some insights into how these devices help to reverse remodel the hearts. And what that has given us is insight that, take for example what we've seen with the AccuCinch device, although mechanically we make the ventricle smaller immediately after cinching the ventricle, what we then see is this process of biologic reverse remodeling, where over time the heart continues to reverse remodel. And that's best graphically displayed on CT scans, where we can have a 3D reconstruction immediately after the procedure and compare it to the way the heart looks 12 months later.
Thank you. So, in cases where cardiac remodeling has been used, what improvement in quality of life and long-term outcomes have been observed?
Our experience is still relatively limited, but when we examine the first-in-human experience, what we found is that the device had the benefit that we would expect. We see improvements in 6-minute walk distance. We see improvements in Kansas City cardiomyopathy questionnaire. So KCCQ scores improve. We see a signal that there may be fewer hospitalizations for heart failure, but we don't yet have proof that these devices help patients live longer. That's one of the endpoints that's going to be looked at in the ongoing AccuCinch trial, which we hope to have data probably in the next 18 months.
Thank you, sir. And what are the key challenges you seen in the widespread adoption of cardiac remodeling devices, and how can these be addressed?
Well, I think there are two things. One is that patients have to have access to care. So right now there are only very few centers, a couple dozen centers that are deploying these devices. Then second is developing the tools to be able to deploy these devices safely and efficiently. And I think we're seeing improvements in both those regards.
Thank you. Do you foresee cardiac remodeling becoming a part of standard care in managing heart failure, or will it remain reserved for more complex cases?
I think it will, and I'm speaking hopefully here, become more mainstream. And the reason why I say that is that as good as medicines are, and the medicines clearly help patients live longer, there's still a high residual risk. So our patients are symptomatic, they don't feel well, and their survival is compromised. So even with the best medical therapy, there's still a need for further targets of therapy, and the mechanical devices, such as those that induce cardiac remodeling, may help fill that gap and improve patient survival.
And sir, last question. So how do you see this therapy evolving in next 5 to 10 years? And are there any upcoming innovation in the field of cardiac remodeling for heart failure that excites you?
I'm most excited about the AccuCinch device, as you can tell, and I'm lucky to be able to be a participant in the AccuCinch trial. I think that device, there are some others as well that physically help to remodel the device that I'm excited about. There are previous attempts, and I'm hoping that some of those might get resuscitated, such as the parachute device that can exclude an area of non-contracting myocardium. So I think this is a rich area of investigation, and I'm really excited to see what evolves over the next 5 years.
Thank you very much for your time, sir, and for giving wonderful insights about this therapy.